There are 17 active cases of coronavirus in Victoria. That's 2 new locally acquired cases notified to the department yesterday. There are 0 new cases in hotel quarantine. The 2 cases have been in ISO. They are close contacts of that Coburg cluster, and it was obviously late in their 14-day period that they've tested positive. They have been actually in hotel ISO because of their household circumstances. They had sought to isolate away from other family members, as many people have done, so they pose no risk to public health more broadly. We wish them well, of course, and I'll take this opportunity to thank the many thousands of people who, over these last few weeks, have been at home, isolating away from other members of the community. We thank them and we acknowledge the fact that whilst we've all pretty well got back to normal in these last couple of weeks, they have been doing the best of work for all of us, not only to keep their own family safe, but to keep every single family safe. So we thank them and absolutely acknowledge the sacrifice and the important contribution that they have made to protecting public health. It does speak to the fact that this UK strain, you can very late in that 14-day period become positive, and it also speaks to why it's so important to have that full 14-day ISO period because of the fact that these, even the last few days, can be very meaningful when it comes to infectivity and positive test results. Speaking of test results, there were 16,594 results received since yesterday. We thank each and every one of those going on for 17,000 people. This is just the absolute key. If you've got any symptoms, get tested quickly, and that helps all of us protect you, your loved ones, and every single Victorian. It's how we track and trace, it's how we keep pace with this virus, or indeed try and get a step ahead of it. That brings to 4,942,705 the total number of test results that we've received since the beginning of the pandemic. Just on vaccines, before I go to restriction changes and some very good news for all Victorians, 839 COVID-19 vaccinations were administered yesterday through our health services. That's the part of the program that we're responsible for, as opposed to the balance, which is the federal government's program. That brings to a total of 2,902 the total number of people that have been vaccinated since the beginning of the week. We're going to continue to report that data in as real time as we possibly can, so that people have got a sense of the progress we're making. I will just stress, though, this is being done in a slow and steady way. Safety first. This is a precious commodity. There's limited supplies of this, and therefore we need to be very much focused on not wasting any and doing this properly. So those numbers will build, but we are well on track, I think, to meet all of the requirements that we've signed up to. I've taken you through those 2 new cases and their circumstances. Brett may want to add to that later on if there's any further questions about that. I now want to talk directly to the changes that we can make. As a result of having brought this outbreak, these different clusters in this outbreak under control, as a result of the patience and the commitment of the Victorian community to that short, sharp circuit breaker, which has worked, and the fact that so many people, those ones I referenced earlier, who are staying at home and isolating away from others, I can confirm that we will, from 11:59 p.m. tonight, based on the advice of the Chief Health Officer, return to our COVIDSafe summer settings, not New Year's Eve, but the settings that were in place at Christmas time before we had those cases come to Victoria from Sydney. So before that Sydney outbreak was extended to Melbourne, and we had Black Rock and that cluster, which I'm sure people can well and truly remember, we had those COVID-safe summer settings. We locked them in, and we can, from midnight tonight, return to those settings. That's a testament to the fact that Victorians have proven, as stubborn as this virus, we've proven ourselves, all of us, in the sacrifices we've made, the decisions we've made, and the conduct that we've exhibited equal to this task. This is by no means over. There's a lot to go. We've got to get everybody vaccinated. That's going to take months and months. There's no alternative to that. But it is an absolute testament to the conviction and the character of the Victorian community that we can make these decisions tonight, effective from midnight tonight. So, masks will only be required in high-risk settings, including public transport, rideshare and taxi vehicles, large retail settings such as shopping centres, supermarkets, department stores, indoor markets. I think people are well and truly familiar with those protocols and those rules as they applied prior to New Year's Eve. Up to 30 people can attend a home per day for private gatherings, up from the 5 that is in place now and the 15 that was in place from New Year's Eve, so back to 30 to your home per day. Up to 100 people at outdoor gatherings. For the first time, can I say this is a very important announcement, for the first time we will, from midnight tonight, so most likely from first thing Monday, we will be able to have 75% of both public and private sector workers back to the office. That is very important in terms of retail trade, hospitality, food and beverage, that whole part of the economy. And not just for the CBD, as important as that is, but in lots of different suburban locations as well, regional centres. The 75% from midnight tonight, in real terms from Monday, to the office, both public and private sector. You would recall that we were on the cusp of moving to that setting when we had our most recent challenges. So I'm very pleased, again, based on public health advice from the Chief Health Officer, we're able to make those adjustments as well. Restrictions on the number of visits to hospitals and aged care facilities will also come off. Having said that, though, individual hospitals may have, for certain parts of the hospital, for instance where patients are immunocompromised, ICUs and things, cancer wards, things of that nature, they may have localised rules, but those statewide rules that we had put in place, they come off from 11:59 tonight. I'm also very pleased to be able to confirm, I'm sure you've seen reports from the AFL, that we will move to 50% capacity at the MCG. That's obviously 50,000 people, just under 29,000 people at Marvel Stadium. We will soon have announcements to make in relation to GMHBA Stadium. There's just some final work being done on that to get that number to the highest level that is safe. That's great news as the footy season, the AFL footy season, is obviously starting quite soon. That'll be something approaching normal, which is something that Victorians have absolutely earned. Again, can I just extend my thanks to each and every Victorian for the way in which they've conducted themselves, the way in which they have followed the rules, followed the advice, been guided just as I am and my team is by the science, by the doctors. That's what's delivered this outcome, both a short, sharp circuit breaker being effective in bringing control and that sense of certainty to those cases. As widely infectious as this virus is, that strategy worked. What's more, waiting this little bit of extra time so that all those cases that were connected to that outbreak could see through their 14 days, that served us very well. And it's with confidence that we can return to those COVID-safe summer settings. But none of it's possible. None of it is possible without the extraordinary efforts of every single Victorian, and I'm deeply grateful to each and every one of you.